alaikum. My name is Dr. Suleiman Khan and I'm a consultant rheumatologist. I'm glad to discuss a few things about rheumatology and rheumatic diseases today. Rheumatology is the branch of medicine which deals with a lot of different types of diseases in relation to joints, soft tissues, muscles, and the different types of arthritis specifically. There are so many different types of arthritis and almost 200 different conditions or diseases come under the umbrella of rheumatic diseases. When we talk about arthritis, the common mistake or the common myth is that arthritis is just limited to joints. Well, that's not the case. Arthritis can affect not only the joints but other organs as well. And when we say arthritis, it can be a multi-system autoimmune disorder rather than just something limited to the joint. For example, if we talk about connective tissue disorders, on one hand, you have got an impact on the joints and joint symptoms, but on the other hand, you have a variety of different body organs involvement. For example, in scleroderma, people can have interstitial lung disease, stiffening of the lungs. Likewise, they can have involvement of the kidneys, what we normally see in lupus as lupus nephritis. So it's not just limited to joints, and that is something that we need to keep in mind when we are dealing with these conditions. When we talk about arthritis, as a rheumatologist, our primary responsibility obviously is to diagnose these cases as early as possible and treat them. The only problem is that these patients normally would come to us at a very late stage, and the patients that normally I see in my clinic, that would have a lot of deformities. They might have quite severe, quite significant nephritis or interstitial lung disease or sclerodactyly or digital ulceration and complications of the diseases. It's not just about the skin or the joints or the kidney or the lung. These patients can have strokes, they can have myocardial infarctions as well. We see that as a complication of these autoimmune disorders, and vasculitis is something which is inflammation of the blood vessels. That can cause a lot of different complications and a very nasty impact on different body organs and morbidity and mortality. So early diagnosis is the key, and unfortunately, because there is no primary care in this country, we get late referrals or self-referrals, and these patients would have quite significant complications. So in order to avoid that, my plea to everyone who is listening to this video is that if you have any swollen joints, any stiffness in the joints, any skin problems such as rashes or psoriasis, you need to see a rheumatologist because you might have some type of arthritis. It's not just about the joints, as I said. If you have oral ulcers, rashes on the face, significant hair fall, bluish or whitish discoloration of the fingers and nails or toes, and extreme sensitivity to sunlight, you might be having connective tissue disorder or lupus. These conditions are so severe and can affect an individual's life to the extent that young ladies potentially could have recurrent miscarriages, a condition what we call antiphospholipid syndrome. So the conditions are quite complicated, quite complex, and they can affect any body organ, and therefore early treatment and early diagnosis is the key to prevent these complications. The concept of personalized medicine is what I think is very, very important. A medicine which helps for one patient is not necessarily going to be the most suitable tablet or drug for another patient. I see patients who would have been started on leflunomide, young ladies of childbearing age, or even in pregnancy. And these young ladies will have spontaneous miscarriages, or complications with the pregnancy. So my suggestion would be not only to the patients, obviously the patients would take whatever doctors prescribe, but to the doctors mainly, that please do not prescribe every single DMARD to everyone. I have seen patients who during their pregnancy would have taken methotrexate. So treatment is rather individualized or personalized, and according to the patient's needs, and you need to take into consideration the risk and benefit. For example, for a diabetic, you're not going to give them loads and loads of steroids, because that can have a negative impact on the control of diabetes. Likewise, hypertension, likewise patients with renal problems. So it's not that every tablet is going to be working for every individual patient, and certainly they can develop complications. In our society, it's a common practice that doctors normally prescribe a lot of non-steroidal anti-inflammatories. Medications such as naproxen, diclofenac, celecoxib, etoricoxib, nimesulide, these are like day in and day out prescribed, which is not a good practice. If these patients, for example, even take these medications for their osteoarthritis for 2, 3 or 5 years, surely they are going to develop hypertension, cardiac complications, renal complications, nephropathies, acute renal failure. So this is not a joke to prescribe these medications for long term and then not keeping an eye on them. So continuity of care is another thing, and so that's why I personally sort of think that the personalized care and individualized care is something that we need to bring into our practice as doctors. Lastly, because it is the COVID pandemic time, I would like to ask everyone to please use their face masks, keep a social distancing as much as possible, and those people, not only the patients, but the general population who is seeing this video, that should have their COVID vaccination. If we can be of help in any thing in relation to rheumatic diseases, we are more than happy to provide that support. I wish everyone a better luck, a better health, and please look after yourself. Thank you.